It's July, and we're focusing on issues around skin health at Consult a Naturopath and on our YouTube channel. So today I wanted to talk a little bit with Dr. Moon Jean Ho and Dr. Julie Nowak about eczema and our approaches to how we treat it. So I work a lot with kids in my practice. A big portion of my practice is pediatrics. And eczema, which another name is atopic dermatitis, is something that we see a ton of coming in. Oftentimes it starts popping up right around 6 months. And if you think about what happens at 6 months, it's when we start introducing foods into our diet. So one of the big triggers for eczema we've determined is food intolerances. And it's not always the case. There can be other triggers and other factors that play into it. But I'd say in a good 80% plus of cases of eczema, there is some sort of food intolerance, some sort of food trigger that is at play in that. So that's almost always my first go-to if someone is coming in and is dealing with eczema, dealing with the redness, itchiness, kind of just can drive you crazy, and it can, really act up, interfere with your sleep. It can be really a challenging thing to deal with. I speak from personal experience dealing with it when I was a child, and it's something I've been able to overcome through naturopathic medicine over the years. So there is a lot of tools. The conventional approach is always basically just putting steroids on it, hydrocortisone creams or relatives, and increasing strength. And often that will work, but as soon as you stop the cream, it usually comes back just as bad, if not worse than before. So I don't think that's a great long-term strategy. And so what we do in our practice is a little bit different than that. So like I said, the first thing I usually go to is looking at food allergies. I'll often run a food allergy panel. We have one on Consult a Naturopath by US Biotech that I've run hundreds of times on people. It just requires a little finger stick and a couple spots of blood. And it looks at antibody levels for 96 different foods. And generally, if there's a food that's causing the problem, it will show up on that test. And what we do then is do an elimination diet, cut out those foods that are showing reactivity for 4 to 6 weeks. And most of the time, we'll see improvements in the skin in that window of time. And then after that, when things are looking better, we start putting those foods back in one at a time, because I don't want people having to be off these foods for the rest of their lives. And often it's one main trigger food or one or two. And so if we can just identify those, then we can just keep those out for a season while we work on some other things to get things doing right. And so we can work away from these allergens rather than having to live our life that way. The second place I usually go is looking at healthy fats and how to put more healthy fats into the skin. And so supplement wise, the two things I usually think about, the first would be some sort of omega-3 fish oils. We have some great ones on our line, but just about any fish oils would be helpful to put those omega-3s. They're really anti-inflammatory. Most of the time when you're dealing with eczema, the body's in a pro-inflammatory state, and it's dealing with a lot of omega-6 pro-inflammatory mediators, which are like leukotrienes, prostaglandins. There's a whole cascade of inflammation that goes off of these fats in our body. And so if you're eating a lot of animal protein, especially conventional beef, conventional chicken, conventional pork, they generally are giving you a lot of pro-inflammation precursors, which then causes downstream effects where you're getting a lot of inflammation in your skin. So cutting back conventional farmed foods, using more grass-fed organic type foods, and adding fish, cold water ocean fish into your diet, along with an omega-3 supplement, can shift that balance away from these inflammatory states into more of an anti-inflammatory state. And a lot of times we'll see the skin start to clear up. There's another supplement I'll often use, is something that has a healthy omega-6 content. There are some healthy omega-6s. The main one I think about is GLA, which is gamma-linolenic acid. And that's found really in borage oil, evening primrose oil, or black currant seed oil. And we have evening primrose oil on our line, and it's great. That will really help shift some of this inflammatory cascades as well. So a good omega-6, the gamma GLA, and then a good omega-3, generally from a fish oil source. You can get it from flax oil too, but I prefer doing it fish oil. And then changing some of these dietary components. That works, improving eczema in like 99% of cases that I've seen. It doesn't always clear it all the way, and sometimes we have to do some more specialized, personalized things, but that's always where I start with I see someone with eczema.